Hey everybody, this is Dr. Paul Thomas with Plum Health DPC here in Detroit, Michigan. And today it's Thursday, April 16th, and I'm giving an update on the coronavirus. Unfortunately, the cases continue to climb here in the United States. We're currently at 673,000 cases with a total deaths of 34,000. Here in Michigan, there are 29,000 confirmed cases and over 2,000 deaths. And over the last 24 hours, there's been 1,200 new cases and 172 new deaths. And as you can see in this map, the concentration of cases has been largely in the southeast Michigan area, although it's spreading across our state. And just in terms of totals, in Wayne County, 5,619 cases, 435 deaths, case fatality rate of 8%. Here in Michigan, the case fatality rate is 7%, which is very high relative to other areas that have been affected by the coronavirus. Unfortunately, the virus still continues to disproportionately affect African American folks who get the virus. African American folks make up 14% of our state population, but 41% of the deaths are in the African American community. Unfortunately, this trend holds across the country as well. In Chicago, where only 30% of the residents are African American, they account for 70% of the deaths. And in Louisiana, it's the same numbers. Only 30% of residents of Louisiana are African American, and they account for 70% of the deaths. So this is not unique to Michigan, but it's indicative of the systemic discrepancies and health disparities that we face as a country. And this is one of the things that we need to address if we're ever going to fix problems like this in the future. So how is the coronavirus different than the flu? I get this question a lot, even though we're really deep into this pandemic. The transmission is by droplets for both, although the COVID-19 may be airborne. We're not quite sure about this. The incubation period is much longer than the flu. And this is what makes the coronavirus so dangerous, because you could be walking around with the coronavirus for days, almost 2 weeks, and not know it and be passing along for that 2 weeks. And that's why we've prompted these stay-at-home orders, because we can't risk people just going outside and going about their regular business, because the infection rate would get much, much higher if people were doing that. There's no antiviral treatment available for COVID-19. There's no vaccine for COVID-19. Currently, there have been 27,000 deaths, and that number may get up to 60,000 to 240,000. And those numbers are from the CDC. Those are estimates from the CDC, or Center for Disease Control and Prevention here in the United States. Whereas for the flu, you typically have 12,000 to 60,000 deaths annually. So we're going to surpass that. And what's crazy about these numbers is that we're going to surpass that in a couple months, a couple weeks, whereas the flu season usually lasts from, let's say, October through April. The hospitalization rate is also staggering for COVID-19. Roughly 25 to 50% of people who get coronavirus are asymptomatic. Then the other 50 to 75% have some sort of symptoms, and about 12% to 20% of those symptoms are severe enough for somebody to go to the hospital. And the death rate, or case fatality rate, right now is around 1.5 to 2.3%. As you've seen in Michigan, that case fatality rate here is 7%. So much higher than what you're seeing with the flu, where the mortality rate or case fatality rate is 0.1%. And the transmission rate is very high. So the flu, you might give it to one other person or 1.5 other people, somewhere in that range. But for coronavirus, you're giving it to 2 or maybe even 5 people or more. And it's really unlikely that this virus is going to die down in the summer, as some might have hoped. So how much does coronavirus care cost? Now, the federal government, through the insurance companies, is trying to make it so that coronavirus testing is completely free. However, if you go to the hospital or the clinic, there will be other charges for using those hospitals and clinic services. So If you're not insured, a complete blood count could cost $36. If you're insured, it could be $11. Comprehensive metabolic panel could be $58. And if you're insured, it could be $16. Flu testing can be $43 for A and $43 for B, which is really high in my opinion. And then your visits, of course, will cost money as well, especially if you visit the emergency department for those services. I did want to compare direct primary care because there's a growing movement of doctors like myself who take care of patients directly, who don't bill or use insurance, and we're able to lower the cost of care for our patients. So right now, the CBC at our clinic is $4. A comprehensive metabolic panel is $6. And it's actually costs $20 for tests for both flu A and flu B. And visits to our clinic are included in the membership. So we visit sometimes with people for an hour and it's still, $50 a month. And that includes urgent care visits. So, our members typically save a lot of money on visits, medications, and labs. So a lot of people want to know the difference between the RNA testing and the antibody testing. So I'm going to talk about that. The RNA testing, they usually use a nasal swab and it goes to the posterior pharynx. And this is really, really uncomfortable. It does not feel good. People cry, they well up, they tear up, and it's quite painful. Sometimes it can induce a nosebleed. And what they do with the swab is they put it into a machine and they amplify the RNA testing. It's called like a PCR test. They're amplifying the virus's replication factors so that they can figure out if it exists in the sample. So they can take a really small sample of the virus and figure out if it's in your body. Okay, what is the antibody testing? Oh, actually, I'll say one other thing about the RNA testing. It takes about a week to get these tests back, 3 to 5 days, up to a week to get the results back. Antibody testing, they actually just prick your finger. They, as in doctors or nurses, they get a very small blood sample, just like less than a drop of blood, and they put it into a cassette. So they would put it into this, they take the drop of blood, they put it into this well, or this hole in the testing cassette, and then they put a little buffer in it, usually like normal saline solution, or aka salt water. And the salt water pushes the blood up to these markers, and you have a control marker, an IgG marker, and IgM marker. So this is kind of, these markings on this cassette are kind of blown up here. A negative sample will just have the control line. If you have IgM antibodies, they'll show up here, IgG antibodies, and then if you have both IgG and IgM, they'll show up on the cassette. And these basically tell us if we've built up an immunity to the coronavirus. So what are these? What is IgG? What is IgM? These are your body's natural defense systems. So when you are exposed to an antigen like the coronavirus, your body first makes IgM. It's really non-specific. Look how big this thing is. It's like a giant thing that's just doing its best to try to adapt and figure out what this virus is and try to attack and kill it. And when this IgM attaches to the virus, the white blood cells come over and recognize the virus is foreign and kills the virus. So your body makes this first, and then your body later makes IgG, which is a much more specific antibody, and it attaches to the virus, and it's almost like an assassin, okay? And it's very good at what it does, and it tracks down this virus, and it alerts your white blood cells to come and kill the virus. And this is how you develop an immunity. This happens with any virus and any bacterial infection. Your body creates an immune response, and it takes a week to 2 weeks to 3 weeks. So let's talk about what these tests look like. So within maybe 3 to 5 days of symptom onset, you're going to be testing positive for that nasal swab test, that RNA, that PCR test. Now, 10 to 15 days later, you're going to start to be testing positive for your IgM and IgG. So that's why we're starting to roll out, we as the medical community are starting to roll out these IgG and IgM tests. Here's another graph of this. You might be in an asymptomatic stage, then you have symptoms, and then your IgM will become detectable, and then maybe at 2 weeks, your IgG will become detectable, and then it's going to remain in your bloodstream essentially forever because now you're immune to it. Perhaps for the coronavirus, doctors are saying, or epidemiologists are saying, 1 to 3 years, you'll have these IgG circulating in enough concentration to fight this off in the future. So that's your long-term immunity. The IgG is the long-term immunity. The IgM is the short-term immunity. Here's another one. You have viral antigen, viral RNA that's easily tested in the early part of the infection. Then you start to have IgM, which tapers off, and then you have the IgG, which is the long-term immunity. Great. So what are the downsides of antibody testing? And that really comes down to this concept of sensitivity and specificity. And I'll try to make this as relatable as possible. But this really comes down to the accuracy of the test. A highly sensitive test will be, let's say, like a 95% sensitivity. That means you're getting 95% of the cases are your true positives, and then you're having a false negative of 5%. So if 100 people have the disease, 95% of them are going to test positive for like an antibody test, but then you're going to have 5 people who have a false negative. And then on the other side of the coin, there's specificity. So if you don't have the disease, so if you've never had coronavirus, hopefully there will be like a 95% of the true negative. So basically, if you get your finger pricked and you have no IgM or IgG on that cassette, there will hopefully be like a 95% specificity. Those are the true negatives, and maybe a 5% of a false positive where you might show those antibodies. The problem here is that there is no one standardized IgG, IgM test. There are several tests being made. Some, locally here in the Detroit area, a large hospital is trying to make their own IgM, IgG test. Henry Schein, a national diagnostic company, is trying to make a test. Confirmed Biosciences is trying to do one. There's also trials at Emory and other big hospitals. So all these different proprietary labs and hospitals and entities are creating these IgM and IgG tests. And here is the problem. We are depending on them to report accurate information and give us a highly accurate test. And so there's just like a hodgepodge of people trying to make this test, which, don't take me out of context, I think it's going to be a reasonable way to determine if people are positive or negative for coronavirus. And it's the best thing that we have, but it's just not perfect. Just like everything in life, it's not a perfect test. And then the cutoff for the sensitivity and specificity is made by the lab. So there's a line that's drawn, and basically you can make the test more sensitive or rule in more positive cases. But if you move that line to the left, you're going to decrease the specificity. So that's up to the lab. They have to make that call. Is it going to be a highly sensitive test or a highly specific test or somewhere right in the middle? Hopefully it's both. But these are the questions for the lab directors to make or to answer. So I always end with this slide. I think it's a great slide. What can you do to slow down the coronavirus? Stay at home, aka social distancing, but that's like a relative term. What does it mean? Keep 6 feet away from other people. If you're going out in public, wear a mask. If you're staying in your home, you don't need to wear a mask. If you need to get stuff from the grocery store, go once a week. Don't go every day because you're going to increase your risk for contamination. If you have extra masks, like surgical masks or N95 masks, please donate them to your nearest clinic or hospital. We're actually running low on our N95 and surgical masks. So if you have some at home, we would love to have them. We're at 1620 Michigan Avenue, Suite 125 here in Detroit, Michigan. If you have some, give us a call, 313-444-5630, or drop us an email. And if you have some new or unused masks, we would love to have them. So thank you for that. Donate blood. And also there's a new thing coming online where different clinics, there's a trial out of Michigan State where different clinics, different organizations are collecting blood samples to get the serum to use as a treatment for coronavirus. So if you've gotten the coronavirus, you developed a strong immune response, meaning you have a lot of IgG and IgM circulating in your bloodstream, you can then donate your plasma and they could potentially give it to somebody who's in the ICU and hopefully try to save their lives. And this has happened. There's a recent story, I think last night on NBC News about it. So if you've recovered, maybe consider donating some plasma to help somebody else in your community or on the other side of the United States. Do not visit elderly and vulnerable populations or relatives, even if you feel fine. This coronavirus is severely affecting our nursing homes and our older populations. So be safe and stay away from older folks who are more vulnerable to this. And the last thing, act as though you have the virus. This coronavirus can be asymptomatic in 25% to 50% of people. So you have to act like you have the virus and treat every interaction as if you have the virus. So wear your mask, keep your distance, and stay safe out there. Thanks so much for watching. Have a wonderful day, and I'll see you next time.